Drinking is inherently a risk. So if you do decide to drink, you can reduce the chance that something bad happens, like cancer or, dying, if you set some reasonable limits. Most people consider themselves social drinkers. The thing is, this term doesn't have any real meaning. You can socially have one drink with dinner, or you can socially have 5 shots at a wild late night party. We need new terminology to describe okay drinking compared to dangerous drinking. Low-risk drinking is defined as no more than 2 drinks a day for men and no more than 1 drink per day for women. This level follows the U.S. dietary guidelines and can reduce the risk of cancer, liver disease, cardiovascular disease, and injuries. These are low-risk guidelines, not no-risk guidelines. Your body is different, and less is always best. There are a few times when 0 alcohol is the low-risk limit, like before driving, when you're responsible for another person's safety, or doing activities that require coordination. You should avoid alcohol completely if you are under 21 years old, if you're pregnant, or if you're taking certain medications that shouldn't be taken with alcohol. High-risk drinking includes either binge drinking or heavy drinking. These forms of high-risk drinking are unhealthy and increase your risk of medical problems, psychological problems, accidents, and injuries. Binge drinking is drinking too much too fast so your BAC levels rise to 0.08% or more, which for men is usually around 5 drinks in 2 hours or 4 drinks in 2 hours for women. Heavy drinking is having too much too often. For men, heavy drinking is having more than 14 drinks per week. For women, heavy drinking is having more than 7 drinks per week. In order to choose the risk level you're comfortable with, you first have to know how to count standard drinks to know if you're having too many at once or over a week. We're still waiting on a scientific definition of low and high risk drinking for people who are trans or non-binary. The best guidance at this point is to use the sex assigned to you at birth and follow these guidelines because of differences in genetics and the ratio of liver to body size. Just remember, the healthiest option is to drink less.